Hello, my name is Lakin Runnels, and I'm a family nurse practitioner student at Eastern Kentucky University. Today I'm going to be discussing a project proposal that implements motivational interviewing for smoking cessation. Smoking is a common risk factor for many chronic diseases that causes a decreased quality of life and early death. The World Health Organization reports that without addressing risk factors for chronic disease, death rates will increase by 17% over the next 10 years. Despite the need for an intervention to assist this patient population stop smoking, usual care has not been found to be successful. In the year 2015, the Centers for Disease Control and Prevention reported that 55.3% of men and 55.6% of women made an attempt to stop smoking. However, only 7.2% of the men and 7.6% of the women were successful. The purpose of this project is to implement motivational interviewing for smoking cessation in the outpatient primary care setting in order to increase smoking quit attempts, increase smoking cessation rates, and decrease nicotine dependence. The target population for this project is adults with underlying chronic illnesses. 4 research studies were evaluated and appraised for this project proposal. Each of these studies were level 2 or level 3 evidence that were randomized or non-randomized and found motivational interviewing to be a successful intervention that assisted patients stop smoking. 3 out of the 4 studies had a patient population that encompassed a respiratory or cardiovascular chronic illness. The 4th study had a population of low-income patients, which could also include patients with chronic illnesses because chronic illness is very prominent in low-income populations. All 4 studies showed statistically significant results that claim that motivational interviewing, when compared with usual care or another smoking cessation intervention, was more successful in helping patients stop smoking, increasing quit attempts, and decreasing their nicotine dependence. The proposed intervention plan starts with recruitment of the individuals. The primary researcher will be present at Baptist Health Richmond Primary Care Clinic for 2 weeks, meeting with patients leaving their appointment. Potential participants will be asked if they would like to take part of a smoking cessation project and will be given a verbal script to ensure they meet inclusion criteria and an informed consent to look over and sign. Inclusion criteria for this project includes the participant must be 18 years or older, be a smoker for at least 1 year, and have a diagnosed chronic illness. There will be 2 sessions during the project. A Gantt chart was developed to visualize the timeline for this project and can be viewed on the poster. During the first session, the following data will be obtained: nicotine dependence levels using the Fagerstrom test for nicotine dependence, the participant's rating of importance for smoking cessation for overall health, diagnosed chronic illness, number of cigarettes smoked per day, duration of smoking habit, gender, age, and participants' rating of their own motivation to quit. After gathering this data, a brief motivational interviewing session will be performed. Participants will be asked why they chose their answers and how they plan to stop smoking, using reflective listening and only giving advice when asked for. This session will be summarized and the final follow-up session will be planned. During the follow-up session, all previous data will be obtained, as well as participants' success or failure with their quit attempt. If unsuccessful, participants will be asked about the number of cigarettes they currently smoke per day and their current motivation to quit. Outcome measures for this project include demographic sheets that include all data obtained during the first session, Fagerstrom test for nicotine dependence scores. This is a test that asks participants a series of questions and they have to choose the answer that best describes their smoking habits or their nicotine dependence levels. A score of 3 or under is low nicotine dependence, 4 to 5 is moderate nicotine dependence, and 6 to 10 is high nicotine dependence. Attitudes toward smoking cessation and verbal report of motivation to quit smoking will both be rated on a Likert scale of 1 to 3, 1 meaning not important or no motivation, 2 meaning somewhat important and somewhat motivated, or 3 being very important and very motivated. All of this data will be displayed on a graph with pre and post intervention data and will be disseminated to stakeholders. This problem is significant to advanced practice nursing Because advanced practice nurses have a responsibility to be aware, implement, and seek out the best evidence-based practice interventions in order to improve patient care. Motivational interviewing has shown to be a cost-effective, evidence-based intervention that has assisted patients with chronic diseases be successful with smoking cessation. Implementing this into the primary care setting would be a great way to reach out to the greatest number of patients that encompass several different chronic illnesses. This is the conclusion of my project proposal. Thank you for your time.